you have been newly diagnosed and it's a cancer that you can barely pronounce, and then an oncologist who is supposed to be the cancer doctor doesn't have the knowledge that he or she needs to be able to help you, it's a terrible place for a patient to be.
I had the pleasure of training in neuroendocrine in Europe, so I saw a slightly different way that it was practiced. When I came back to America to take care of my patients, I saw that there was a real lack of knowledge about the disease, not only among the patients, obviously, but even among the physicians and caregivers.
I believe the biggest challenge for patients these days is they don't know what neuroendocrine cancer is, so they cannot be their own best advocate if they don't know what it is, and B, their doctors don't know what neuroendocrine cancer is. And so how can they possibly be treated right and diagnosed properly?
I had neuroendocrine, and I'm only sitting here because an oncologist from breast cancer 15 years ago admitted me to the hospital, and therefore I had to have surgery. But if I had waited the 3 weeks that the surgeon's office wanted me to wait, I wouldn't be sitting here.
I'm in a unique position because I sit on both sides of the fence of being a patient and also a healthcare professional, and I think that on the healthcare professional side of things, it's a difficult disease process to understand because it's not as prevalent as, well, maybe more prevalent than we think it is, but we don't see it a lot in day-to-day practice unless you're in a specialty center.
I think the biggest challenge that I see out here in terms of achieving the best possible care is one of knowledge of this cancer, both from the patient perspective and from the perspective of physicians who are diagnosing as well as trying to treat this particular type of cancer.
I feel that community oncologists are not well aware of drugs that could help much the patients, specifically from the diarrhea perspective, from the flushing. New developments have been out and FDA-approved medications have been out, and I think community doctors are not aware of what is the cause of a diarrhea that is very complicated.
We don't understand the molecular underpinnings of neuroendocrine tumors the same way we do for many other cancers. And that's a clear deficiency.
You must know that these diseases are really hard to diagnose in early stages, and we have no screening markers to use. So a good training is very important to diagnose these diseases.
Well, the biggest challenge as I did my research was really finding a local expert to depend upon to have follow-up. And I found that it was many of the institutions did not have a NET expert, and that the information available at the institution was very limited and often wrong.
Well, I've learned and I've witnessed that if you find the proper care and if you get a specialist or a doctor that understands your disease, you will do better, live longer, and have a much better outcome.
People just never hear about neuroendocrine, and that needs to change. The news media needs to change the way they are reporting. Then the doctors would be, number one, they would be curious, and number two, if there was an educational webinar even that could get them informed no matter whether they're rural or city physicians, and get to the most physicians possible, then I think that would help.